Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
It is time to get your notebooks or iPads out, my fellow men, and take notes, because Dr. Jitka Lom from Express Care is here, and we are talking about prostate cancer tonight and what men can do to recognize the signs and symptoms of what may become prostate cancer. We hope not, and what they can do to hopefully steer clear of it. All right, so time for some questions from our online community. You ready, Doc?
Yes.
All right, question number one is, prostate cancer runs in my family, Dr. Lom. Is there anything I can add to my diet or supplements I can take to make it less likely I will get the disease?
I don't think so. I think the most important thing for you would be to be vigilant and to have testing done early. If you have a strong family history, then your screening should begin at age 40, where you get the digital rectal exam, maybe an ultrasound of your prostate if there's anything abnormal, and also a blood test called the PSA test, only if there's a very strong family history. The PSA test is prostate-specific antigen. That is a blood test that we can do to help find out whether you have prostate cancer.
Okay, and as always, you want to disclose your entire family medical history to your physician.
It's really helpful.
Yeah, the more you say, the better off you are.
Yes.
Okay, so question number two kind of dovetails off what you just said, Dr. Lom. What is the PSA test? You can go into more detail about this, and how accurate is it?
Yes, so the PSA test is a blood test. It's very simple to do, and we use it especially to monitor how somebody who already has prostate cancer is doing, meaning their number should be going down with treatment. We use this, in the past this number was used as a screening test, meaning people would just go have a PSA test done every couple of years to see if they have any disease. And what happened was that they picked up too many prostate cancers. Why? Because, again, this is a disease that's very common as people get older. Not all of them need treatment, not all of them actually need anything, but we're picking too many of them up, doing too much, causing too much invasive treatment that was not necessary. So the guidelines have changed now, and the PSA test should only be done if a nodule is felt, or if there's a strong family history, or if there's some other reason that your physician can think of, but not just randomly on healthy people. So that's the lowdown on PSA.
All right, thank you very much.
You're welcome.
Right, question number three now. What kinds of issues should I think about when choosing a treatment for my prostate cancer?
Well, in this case, you should really listen carefully to your oncologist, which is your cancer doctor, or your urologist, which is the specialist that deals with prostate cancer. And those people would advise you on the best treatment for you. When a biopsy is done, meaning they take a little needle, put it through that ultrasound machine and take a little piece of your tissue, send it to the lab, they look at it under the microscope, that's called a biopsy. Your cancer is at that point staged, and we tell you, okay, this is how aggressive your cancer is, this is how far it has gone, this is whether it has spread or not. And the treatment is different depending on those factors, whether it's a very aggressive one, whether it has spread, how old you are, and so on. The lightest treatment for prostate cancer is doing nothing at all. Let's say it's an 85-year-old gentleman who has been found to have prostate cancer and it's very mild. There's nothing needed to be done, because that man will probably have some other thing to worry about that would cause his death later on, such as a stroke or a heart attack.
Oh, no.
The prostate is not going to bother him because it's very, very low grade. But somebody who's 40 years old and has an aggressive prostate cancer needs very aggressive therapy. That might include surgery, it might include radiation, it might include microwave therapy. They can put sort of little pellets in there to kill it off, and slowly over time that prostate will be destroyed. So there are many different kinds of therapies, so many, including medication. So the choice is really dependent on the stage of cancer, the age of the patient, and how aggressive it is.
Well, the next question is very logical, follows that answer from you. What kind of side effects can I expect from the treatments, and how long will they last?
And that would depend on the treatment that you have, but most of the time people can expect some discomfort depending on what treatment they're undergoing. If they have surgery, of course, there's going to be a little recovery time. With some of the other treatments, the radioactivity and the microwaves and stuff, there may be some swelling and there may be some blood in the urine. Almost everybody with prostate cancer will end up with some blood in their urine for some time as things are healing. But as they heal, then people have an excellent chance of survival. Again, if there's early detection, you can have a great result where you go on and live a long and happy life.
All right, and our last question, Dr. Lom, what is advanced prostate cancer and can it be cured?
Advanced prostate cancer usually means that it has spread beyond the prostate, already into the lymph nodes in the pelvis, sometimes to the bones, to the liver, to the brain. This is how people die of prostate cancer if they have what we call metastatic. Metastatic means that the disease has spread beyond that organ to other organ systems, and then the cancer is taking over the body. Then people need chemotherapy, they need radiation, they may need other surgeries, but basically they need a lot of aggressive treatments. Can it be cured at that point? It really just depends. Sometimes yes, sometimes no. Hopefully you would pick it up at an early stage before that cancer has spread to the other parts of your body.
Well, certainly with the help of medicine and the power of prayer, we can hopefully overcome it.
And that one is very important too.
Positive mental attitude.
Yes.
All right, well,
Definitely.
Doctor, thank you so much as always.
You're welcome, and thank you.
All right, we'll see you next week.
Yes.
All right, and we'll see you.